Hi everyone. I'm going to be presenting my Module 3 discussion board on self-actualization. I'll be talking briefly about a lead educator role that I'd like to take, the qualities that I possess and need to work on to be successful in that role, as long as some of the key areas of education in that role and the adult learning model that I would use to teach it. So the lead educator role that I selected is preceptor for new hires in my job, which is home care. Currently, you are in a classroom type setting with a clinical educator for 2 weeks, and then you're out in the field with a preceptor for 2 weeks once you're hired to the home care job. So the strengths, according to Rath and the Strength Finder assessment that I feel I possess, are connectedness, learner, discipline, developer, and achiever. The bottom four, I feel like really closely relate to being successful as a preceptor. Rath wrote that a learner has a great desire to learn and wants to continually improve. And I do feel like that's true. That's why being a preceptor is on my list of yearly goals as an employee. And discipline is somebody that enjoys routine and structure. And I think that's part of what makes me successful in home care is that I do so much thrive on routine and structure that I self-impose. So I'm able to meet productivity and have tricks of the trade for scheduling, things like that. A developer, according to Rath, is someone that recognizes and cultivates the potential in others. I definitely think that I have that as well as most OTs have that. And we see that with our patients, but we also have the potential to see that with our colleagues and are able to spot signs of small improvements as well as derive satisfaction from those improvements. And finally, achiever, someone who has a great deal of stamina and enjoys hard work and takes satisfaction from being busy and productive. I think any of us in the OTD program definitely probably can relate to being an achiever. The strengths that I feel like I need to develop are self-assurance and command. I always feel like there's somebody that knows more than me and that there's always something that I can learn. So I think that it's hard to feel self-assured when you are a learner and a developer and an achiever who constantly wants to be growing. But I think just realizing that I do know enough to be a preceptor, and then having the command, even though I think I'm on the younger end of clinicians, and I may be potentially training somebody that has a lot more experience than me. I think having command can be a difficult thing for me, but it's something that I'm interested in working on, especially in the role of preceptor. So 3 prioritized learning needs that I selected, and I'll just read one brief sentence about each, kind of written as a learning objective. So daily operations. In order to meet the daily work requirements, all employees must have a thorough understanding of their daily roles and responsibilities. Troubleshooting in the field. Unique to home care, it is the necessity of each discipline to be competent in triaging medical challenges while in the patient's home and have a thorough understanding of when emergent care is needed. Finally, interdisciplinary communication. Communication between the care team, i.e. therapists, nurses, supervisors, physicians, and caregivers, is vital for patient success in the home and to reduce rehospitalizations. Of these 3 prioritized learning needs, I selected the second one as my adult learning topic because I feel like it was the one for me as a new hire in home care that was the most difficult to understand and still can be challenging for me when to select. You recommend somebody see their physician, when you can put them on for a next day nursing visit, when you feel like they need emergent care via 911, because I came from an inpatient setting where I could defer to nursing or call a code. Can't do that in home care. So for me, teaching this, troubleshooting for an OT, I really felt like everything that we've talked about to date is important, but we've talked about it so much, I feel like we really, really know it. So understanding what the person I'm precepting, what their learning style is, do they prefer to be hands-on? Do they like to see me do things? Do they like to write them down? Also giving them opportunities to ask questions, to use technology, understanding the needs of a younger learner versus an older learner. Those are things I feel very comfortable with, and I wanted to push myself outside a little bit of that when talking about a model. So in looking through Rothwell's book, I found Endorf and McNeff's adult learning model. I felt like this really spoke to me as relevant as a preceptor, because some of the key points, these are not all of them, but they felt that learning for an adult learner should be practical, self-directed, results-oriented. It should identify the clinician to meet his or her own learning needs. It should develop independence, self-confidence, and should be integrated and highly participative in the process. The adult learner should be. So coming back to a couple of these practical, I think that's key as a preceptor. We want to be teaching skills that are actually going to be useful. Troubleshooting in the field certainly ticks that box. Self-directed and results-oriented, as well as meeting his or her own learning needs. These all kind of relate in that as a home care clinician, we're out in the field alone. Troubleshooting is something that we need to be motivated to do, and we can't simply just leave a patient. We need to understand when we need to seek additional medical care and develop independence in this, feeling confident that we made the right decision and that our bases are covered, the patient is safe, we've documented thoroughly and made the correct recommendations. This comes in with self-confidence. The more we practice this as a preceptor, troubleshooting it when we see it, giving them the tools to know what to do, helps to build self-confidence. And then obviously, because we are in the field and the clinician is treating patients, it is highly integrated and participative on the trainee's part. So my question to my fellow classmates is, when do you feel like this style of learning or some of these key components that I talked about here were either utilized successfully or not so successfully in your own learning, and how could they maybe be improved upon in the future, either with you as a preceptor or you as a trainee in some sort of learning experience? So thank you. And here are my references.